This video is about causes of pneumonia, symptoms, and how it affects. Pneumonia infection will affect you when you inhale. The air comes down to the lungs and then small particles with virus or bacteria follows with when you inhale. And when you get this virus or bacteria, it will spread in different ways to your lungs, and it will cause pneumonia. There are different ways how this virus and the bacteria spread. The virus is mostly spread through the air. For example, it will spread when you are sick and then you cough, you sneeze, or you exhale. The cough and the sneeze that contains virus produce liquid, and the liquid form into droplets. And if you get these droplets, you can be infected. But you will not be infected directly when the droplets come to your skin or to any object. But if you touch your skin or the object that is contaminated and you put it in your hands or in your mouth or in your eyes, you will be infected by this virus. So that is why it is very important to always wash your hands. There are different bacteria caused by pneumonia. And the most common bacteria is Streptococcus pneumoniae or pneumococcus. This bacteria is not specially contagious, so hindi siya masyadong nakakahawa. So it almost like we can say this is a mild bacterial infection. Another bacteria that can cause pneumonia is Mycoplasma. And Mycoplasma bacteria is more contagious bacteria than Pneumococcus. So mas nakahawa itong Mycoplasma na ito kaysa Pneumococcus na bacteria. And so, like some other bacteria, Mycoplasma have also different types. And they live mostly in eukaryotes, for example, in the warm and bloody animals, in the insects, and in the plants. If you will get this bacteria, it will first affect the tissue in your airways and give inflammatory reaction. And eventually, the bacteria comes down to your alveoli, and by that, you can get pneumonia infection. Another bacteria that cause pneumonia infection is Legionella bacteria. This bacteria is commonly live in the nature where there is water, but not in salty water. So this bacteria can survive in a sea water. Reproduction of Legionella bacteria mostly in a stagnant water, and also they live in a water system, in the air conditioning, shower, or water tap. And this bacteria needs to come down in the lungs, in alveoli, before you will get infection. And this is more dangerous bacteria infection compared to the other bacteria, and it can be life-threatening. I said before that this bacteria is living in the water. You may be wonder, will I be infected when I drink water? No, you will not be infected in this bacteria if you drink water. However, when you inhale and contains with this bacteria, it may be dangerous because it may infect you and can be life-threatening. When I studied before and was in my training in the hospital where there was a shower and tap water, we flush the water first around 5 minutes before we use it. And this is because to avoid the contamination of this Legionella bacteria. Another cause of pneumonia infection is the virus. RS virus is the common reason for a serious pneumonia infection, and mostly it affects the infant and a child under 2 years old. But bigger child and the adult can also get this virus infection, and it gives mild symptoms. So it means that the adult will not be so sick compared to the infant and a child under 2 years old. RS virus affect in your airways, and the virus spread down in your bronchioles. Bronchioles is a deeper part of your lungs. Another is influenza virus. This virus is also common cause of respiratory infection, and it affects the upper part of your lungs, and it can give fever, muscle pain, you will feel tired, you will get headache, and also you will cough. And all of these feelings are the inflammatory reaction to your body. And this influenza virus can come, what we call this, a secondary respiratory infection. Okay, and the secondary respiratory infection can occur if the tissue in your airways is damaged or injured caused by other microorganisms. You know that the influenza virus itself is normally not dangerous infection. However, it can be life-threatening if the secondary bacterial infection occurs caused by other microorganisms or other diseases like heart failure, diabetes, or other lung disease. We have to remember that virus and the bacteria is not the only reason or not the only cause you will get pneumonia infection. There are also many other reasons. One reason may be that your airways has already been damaged before and cannot fight the bacteria or the virus. Another is if you have diseases that weaken your immune system, like for example, if you have a cancer or any other diseases, and also if you have a chemotherapy treatment, these things can also weaken your immune system, and in this way you also have a big risk or a reason that you will get a pneumonia infection. Okay guys, now the last is pneumonia symptoms. Some people who are infected with a virus or with a bacteria, they do not get pneumonia infection. Instead, they have a mild symptoms, and also some they do not have symptoms at all. So it is different between people to people. It depends if you have a strong immune system or weak immune system. And also it depends how your body fight the virus or the bacteria. The symptoms is you will feel cold, you will also get fever, and then your body is shaking or your body is shivering because of the fever, mostly if you have high fever. And also you will feel pain in the throat, you will get muscle pain, you will get headache, you will cough, and you also sneeze. And if you have mucus or a sputum and you cough it up, then it can be colored yellow, green, brown, or white, or it can also be mixed with the blood. Also, when you take a deep breath, you will get chest pain, and you can also get breathing problems. That's because the function in your lungs is not effective as before. You also feel tiredness, and dizziness and nausea feelings can also come up. If you go to the doctor and you explain these symptoms, then most of the time the doctor will listen to your lungs with stethoscope, and your lungs may sound weird, and the doctor may hear wheeze sounds, cracking sounds, or a peeping sounds. And that's all for this video. I hope this helped, and please subscribe for more videos. Thank you.